I am Sara Garcia, and this is my presentation for Capstone and my 5-year plan. Um, for the outcomes listed in the undergraduate RN to BSN student handbook, um, this is the humanity and society outcomes, which reads practices safe and effective holistic patient-centered care to a variety of patient clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. This was achieved in Nursing 4321, which is Nursing Theories and Online Education. We had this assignment that had focused insight questions. It asked us scenarios, and we had to apply the appropriate nursing theory to it that best served the patient, that would help with their care. The lifespans and continuum outcomes supports patient clients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. So for this one, comprehensive holistic health assessment, we had an activity that gave a patient scenario, and once again we had to list the nursing theory, but along with it we had to create like a care plan. And so the detailed care plan did all these things because you had to talk about the disease, how to promote, like how to prevent it, how to promote wellness, and you had to do goals and planning. So that was all involved in this outcome. Another outcome for that subject evaluates patient-centered care for patient clients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. So also in comprehensive holistic health, we had a shadow health program that was like a live stimulation. So we got the chance to do real scenarios, excuse me, with real patients. And it involved us having to do assessments, interventions, critical thinking, when we would alert a doctor to something, what we would do if we found something wrong. Evidence-based practice and clinical reasoning outcomes synthesizes clinical reasoning and judgment in nursing practice, utilizing critical thinking, nursing process, research and evidence, and based practice. So this is nursing inquiry evidence-based practice, which is nursing 4390. There was a lot of research involved in that class, so there's multiple examples we could use, but for this I used the quantitative research assignment, which was actually multiple assignments that we had to carry out, and it focused on finding an article that was quantitative research, but it had to focus on nursing practice, and then we had to do critiques of that. And so all the while we had to see if that research nursing practice was applicable or if it was relevant. And so it made us use critical thinking to see if that could apply to the nursing field. Patient client centered care outcomes. Employ safe, effective patient centered care using theories and evidence-based findings in collaboration with patient clients and members of the interprofessional and intraprofessional healthcare team. Nursing 4620, care of adults with compromised health states. This was a pretty depth assignment, the practicum reflection. There was multiple ones. This first one, however, required us to interview a patient in a complex health state. And then we were also reading a book of a person in a complex health state that was compromised. And then we had to compare these two people, discuss pathophysiology, their disease, complications of it, what could be done for them as far as resources, what could have been done to prevent these things. And then it also involved coming up with communication strategies to use during the interview, how we're going to have to work with other people in the team, healthcare team, to care for this patient. So it kind of used all those things. It also asked us how the patient felt about the collaboration of the healthcare team. Professional roles outcome differentiates multiple role dimensions and practices with ethical, legal, and regulatory parameters when caring for patient clients as a member of the interprofessional and the intraprofessional healthcare team. Nursing 4321, Nursing Theories and Online Education. The Differentiate Essential Competencies Formal APA paper. This involved a patient scenario that was given to us where something went wrong. In this particular scenario, it was a patient who fell while other healthcare professionals were very close by. In this scenario, there was an ADN and a BSN, and some other people of the healthcare team, and we had to explain what would be expected of the ADN and BSN, what should have been done to begin with, the legal ramifications of the scenario, ethical, should it have even happened to begin with these people present, but we definitely had to break down the different roles between the BSN and the ADN. Professional roles and outcomes. Demonstrate professional integrity, effective communication, active inquiry, and service to the community. Nursing 4540, care of communities, the Civic Pride and Diversity Initiative assignment. So this was another one that carried over. There was many steps to it that went throughout this class, and it was the main project for the class. We had to pick a program that serviced civic pride or needs, diversity, or some kind of inclusion in the workplace or community. That was nonprofit. We volunteered there. We interviewed members. We interviewed who the community was serving. We observed how they documented and organized. And then we also developed nursing goals for the program, where nursing could help in the program to better serve the community and better serve the members. So we definitely had to do a service to the community. So for my 5-year plan, I put wound care nursing. It would take a little while because you do have to save for the classes, so it would carry on through 5 years, I believe. So on the right hand side, I put what comes directly from the certification board, which is the National Alliance of Wound Care and Ostomy eligibility requirements. So you do have to have a license in good standing of any of those listed licenses. I would have an RN. Education requirements, you have to have one of the two. Graduate from a skin and wound management course or a current active certification. So those kind of go hand in hand, because when you graduate, from what I've researched, when you graduate from a wound management course, you usually achieve one of those certifications. And then experience, complete 120 hours of hands-on clinical training with an approved NAWCO preceptor, or complete 2 years full-time or 4 years part-time experience in the approved profession with ongoing active involvement in the care of wounds. For me, I would need to obtain one of the education requirements, because I currently don't have that. And like I said, the courses range from $3,000 to $6,000 for like an 18-hour course. Some hospitals do cover it. From what I found, the hospital I work at does not. So that would be something that would have to wait for a little bit. In the meantime, though, I would look into our wound care team where I currently work and see if there is a preceptor that I could follow and shadow. I do work on an acute surgical floor, and we do take care of wounds. So from what I've checked, I believe that could count as a wound care experience for me, for the experience part, but I would also like to shadow a wound care nurse. And then obtain the education requirement, of course. and eventually sit for, so this requirement on the side is what you have to have just to get your National Alliance of Wound Care and Ostomy certification. So then after you do these requirements, you then have to sit for the board test. And after that, you can do a multiple care of things. You could work in acute setting. You can work in clinics. So I don't know which one I would end up in, just because I don't have a lot of experience in the field yet. So that is my 5-year plan. Listed here are my references, which was the Lamar University, the undergrad RN to BSN student handbook, and then the National Alliance of Wound Care and Ostomy. So that was my presentation. Thank you for listening.